mynews.studio.
Did you know that over a third of cancer cases worldwide could actually be prevented if we focused on just a few key risk factors? Imagine what that would mean for millions of people.
That's a staggering figure. And just to set the scene, today's date is February 9th, 2026. The World Health Organization analyzed data from 185 countries. Out of 18.7 million new cancer cases in 2022, about 7.1 million, so 37%, were linked to 30 risk factors that can actually be changed. It's not just numbers, that's real people.
Right. The biggest driver the study found was tobacco. It's linked to 15% of all cancer cases. That's more than 1 in 7. And it's not limited to just smoking. Any kind of tobacco exposure counts.
But tobacco isn't the only culprit. Infections, like HPV and Helicobacter pylori, are behind about 10% of cancers, mostly cervical and stomach.
Absolutely. And then there's alcohol, linked to about 3% of all cases. Even having just one drink a day increases your risk. There really isn't a safe level when it comes to alcohol and cancer.
When you break down the numbers further, it gets even more striking. Men face a 45% preventable cancer burden, women about 30%. What's behind that difference?
Mainly, it's about different exposures. Men tend to smoke and drink more. The region matters too. For example, in East Asia, the preventable cancer rate for men is 57%. That's much higher than the global average. In Latin America and the Caribbean, it's only 28%.
So it's not just about personal habits. There's policy, culture, even air quality shaping these risks. Take East Asia. High smoking rates and more air pollution mean more lung cancer.
Lung, stomach, and cervical cancers together make up almost half of all preventable cases. That's where interventions could make the biggest difference.
Dr. Andre Ilbawi and the WHO said tobacco control, vaccination, and cleaner air are all proven solutions. If we know what works, why aren't we seeing more progress?
It comes down to implementation. Wealthier countries have more options for screening and vaccination. For example, HPV vaccines are easy to get in high-income areas, but much less available in places with limited resources.
Screening for cancers like cervical or colorectal depends on good diagnostics, which are lacking in many regions. Still, some steps work anywhere, like helping people quit smoking. After 15 years smoke-free, lung cancer risk drops by half.
And for infection-related cancers, which make up 10% of preventable cases, we already have vaccines like HPV and hepatitis B. So the challenge isn't inventing new science, it's making sure everyone has access.
It's easy to miss factors like high BMI or inactivity, but they add up too. Regular exercise and a balanced diet can translate into more years without cancer.
The core idea here is that prevention works better and costs less than treatment. Coordinated action from governments down to individuals could save both lives and money.
So, in summary, most cancers tied to tobacco, infections, and alcohol can be prevented, but it takes both personal choices and policy changes. What should individuals prioritize right now?
The basics. Quit smoking. Get vaccinated when possible. Reduce alcohol. Keep active. And watch your weight. But we also need governments, especially in high-risk areas, to make sure everyone can take these steps.
And unless we tackle deeper socioeconomic barriers, the people who need prevention the most will stay at risk. The science is settled. It's the action that's missing.
That's the real challenge. Over a third of cancers could be stopped, but only if we turn knowledge into action.
Thanks for joining us for this deep dive into cancer prevention around the world. We discussed why tobacco, infections, and alcohol matter, the disparities in prevention, and why public policy is just as important as personal choices.
Prevention saves more lives than treatment ever could. For more details, you can check out the WHO's latest report.
Thanks for listening. This episode was brought to you by mynews.studio. You can try it now for free.